Hello, this is Peter Jermain. Here are the notes. And today I'm going to be making a video discussing the skeletal system, of which I have a replica here. The main components of the skeletal system include the bones of the skeleton and the cartilages and ligaments and other connective tissues that help to stabilize and interconnect the bones. The skeletal system has a diverse range of functions, including providing structural support. It stores minerals and lipids. It produces blood cells. It protects delicate organs and tissues. And it also provides leverage for movement. Anatomical classification of the bones of the skeleton is performed by grouping them according to shape, and there are 7 classifications. Sutural bones are small, flat, odd-shaped. Pneumatized bones are hollow and/or filled with numerous air pockets. Short bones are box-like in appearance. Irregular bones have complex shapes, whereas flat bones are very thin. Long bones, as the name implies, are very long and slender, and sesamoid bones are very small, round, and flat. The human skeleton is typically divided into 2 main components: the axial skeleton, which consists of the skull, the thoracic cage, and the vertebral column, as well as the appendicular skeleton, which consists of the pelvic girdle, the pectoral girdle, as well as the upper and the lower limbs. So we'll go through these, and we'll start with the appendicular, or rather the axial skeleton. So the skull has the cranium, which consists of 8 bones, and facial bones, of which there are 14. So the cranium is made up of the occipital bone, which seen here from the posterior view helps form the rounded back of the head. There are 2 parietal bones on the left and right. The frontal bone forms part of the forehead. The temporal bone on the left and on the right also includes within it the auditory ossicles. So there is the malleus, the incus, and the stapes. If you can see here, is the sphenoid bone, which forms part of the floor of the cranium. And then in here you have the ethmoid bone, which forms part of the orbital wall and part of the roof of the nasal cavity. So transitioning to the facial bones, we have the left and the right maxillary bones, the palatine bones, which form part of the floor of the orbit. There are the nasal bones, the inferior nasal conchae, the zygomatic bone on the left and the right side, which forms part of the cheek, the lacrimal bones, which are very small, the vomer, which the vomer forms part of the inferior portion of the nasal septum, so that is located right here. And then, of course, you have the mandible, which is the lower jaw. And many of these bones can be viewed better by removing the skull cap. So, for example, from the superior view, you can better visualize the sphenoid bone and the ethmoid bone. And so finally, there is the hyoid bone, which is the only bone in the skeleton that is not connected directly to other bones, and that is located here. And it's sometimes considered to be a facial bone, but it's certainly a skull bone. Next, we'll discuss the thoracic cage, which is located here. There are 12 pairs of ribs for a total of 24 ribs in the sternum. Then we have the vertebral column. So the adult vertebral column is composed of 26 bones. So you have 7 cervical bones, so C1 through C7, and then you have 12 thoracic vertebrae. So you have T1 through T12, 5 lumbar vertebrae, L1 through L5, the sacrum, and the coccyx. And so that concludes the the axial skeleton. The appendicular skeleton is composed, as I said, of the upper and lower limbs, as well as 2 supporting girdles. So first there is the pectoral girdle, which consists of the clavicle, as well as the scapula. The upper limb is made up of the humerus, the ulna, which is this one here, and the radius. And then you have the bones of the hand. So first there are the carpal bones, and there are 8 per hand, organized in 2 rows, proximal and distal rows. So you have the scaphoid, the lunate, the triquetrum, the pisiform, and then the other row you have the trapezium, the trapezoid, the capitate, and the hamate. And then you have 5 metacarpals and 14 phalanges, which are the proximal, middle, and distal phalanges of the hand. And so then we can go to the pelvic girdle, which consists of 2 bones, 2 hip bones, each of which is a composite of 3 bones, the ilium, the ischium, and the pubis. The femur is the longest bone in the body. Then you have the patella, or kneecap. You have the tibia, which is the large medial bone of the leg, and the fibula. And then for the foot, you have a similar anatomy to the hand. You have the tarsal bones of the ankle. There are 7 of them: the calcaneus, the talus, the navicular, the cuboid, and the cuneiform bones, which are here. And then you have the metatarsals and the phalanges of the foot. So an application of skeleton anatomy to my future career in diagnostic imaging would be an imaging modality that's currently used in the clinic called bone subtraction computed tomography, which is commonly used to assess intracranial aneurysms. And this particular imaging technique uses dual energy photon beams to attenuate the wavelength dependent attenuation characteristics of different tissue types. So for example, bone tissue in the head versus the soft tissue of the brain and the blood vessels. And so the way that the imaging works is that the data from the 2 separate scans are mathematically reconstructed in such a way that you can reduce or minimize the impact of signal coming from bone. And in that way, you're able to visualize just the soft tissue or just the blood vessels within the brain or head, instead of seeing, for example, the parietal bones or the frontal bone or the occipital bone or the other bones of the skull or facial bones. So that concludes this video. Thank you.